Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Patient tubes, NGT, chest, and tracheostomy. Which of the following is not true regarding the types of a nasogastric tube? Option A. Cantor tube is a single lumen long tube with a small inflatable bag at the distal end. Option B. Miller-Abbott tube is a long double lumen used to drain and decompress the small intestine. Option C. Levin tube is a double lumen nasogastric tube with an air vent. Option D. Sengstaken-Blickmore tube is a 3-lumen tube. Right answer is option C. Levin tube is a double lumen nasogastric tube with an air vent. A Levin tube is a single lumen nasogastric tube, while a Salem sump tube is the double lumen nasogastric tube with an air vent. A newly RN nurse is about to insert a nasogastric tube to a client with Guilan Barre Syndrome. To determine the accurate measurement of the length of the tube be inserted, the nurse should: Option A. Place the tube at the tip of the nose, and measure by extending the tube to the earlobe and then down to the top of the sternum. Option B. Place the tube at the tip of the nose, and measure by extending the tube to the earlobe and then down to the xiphoid process. Option C. Place the tube at the tip of the nose, and measure by extending the tube down to the chin and then down to the top of the xiphoid process. Option D. Place the tube at the base of the nose, and measure by extending the tube to the earlobe and then down to the top of the sternum. Right answer is option B. Place the tube at the tip of the nose, and measure by extending the tube to the earlobe and then down to the xiphoid process. A stroke client who was initially on NGT feeding was able to tolerate soft diet, so the physician ordered for the removal of it. The nurse would instruct the client to do which of the following before he removes the tube? Option A. Inhale and exhale simultaneously. Option B. Take a long breath and hold it. Option C. Do a Valsalva maneuver. Option D. Blow the nose. Right answer is option B. Take a long breath and hold it. Holding the breath closes the glottis, hence it will be easier to withdraw the tube through the esophagus into the nose. And this method will also prevent aspiration. The nurse is preparing to give bolus enteral feedings via a nasogastric tube to a comatose client. Which of the following actions is an inappropriate practice by the nurse? Option A. If bowel sounds are absent, hold the feeding and notify the physician. Option B. Assess tube placement by aspirating gastric content and check the pH level. Option C. Warm the feeding to room temperature to prevent the occurrence of diarrhea and cramps. Option D. Elevate the head of the bed to 45 degrees and maintains for 30 minutes after installation of feeding. Right answer is option D. Elevate the head of the bed to 45 degrees and maintains for 30 minutes after installation of feeding. If the client is comatose, place in a high Fowler's, which is in a 90-degree level. A nurse is checking the nasogastric tube position of a client receiving a long-term therapy of Omeprazole, Prisolec, by aspirating the stomach contents to check for the pH level. The nurse proves that correct tube placement if the pH level is: Option A. 7.75. Option B. 7.5. Option C. 6.5. Option D. 5.5. Right answer is option D. 5.5. Gastric placement is indicated by a pH of less than 4, but may increase to between pH 4 to 6 if the patient is receiving acid-inhibiting drugs. Before feeding a client via NGT, the nurse checks for residual and obtains a residual amount of 90 milliliters. What is the appropriate action for the nurse to take? Option A. Discard the residual amount. Option B. Hold the due feeding. Option C. Skip the feeding and administer the next feeding due in 4 hours. Option D. Reinstill the amount and continue with administering the feeding. Right answer is option D. Reinstill the amount and continue with administering the feeding. If the residual feeding is less than 100 milliliters, feeding is administered. Continuous type of feedings is administered over a _hour period. Option A, 4. Option B, 12. Option C, 24. Option D, 36. Right answer is option C, 24. Continuous feeding is administered for 24 hours. An infusion pump regulates the flow. A client is subjected to undergo a chest X-ray to confirm the endotracheal tube placement. The tube should be how many centimeters above the carina? Option A, 2 to 4 centimeters. Option B, 1.5 to 3 centimeters. Option C, 1.5 to 3 centimeters. Option D, 0.5 to 1 centimeter. Right answer is option C, 1.5 to 3 centimeters. Placement of an endotracheal tube is confirmed by a chest X-ray and the correct placement is 1 to 2 centimeters above the carina. After the client had tolerated the weaning process, the physician ordered the removal of the endotracheal tube and will be shifted into a nasal cannula. Which of the following findings after the removal requires immediate intervention by the physician? Option A, sore throat. Option B, hoarseness of the voice. Option C, coughing out blood. Option D, neck discomfort. Right answer is option C, coughing out blood. A sign of a tracheal or esophageal perforation which prevents oxygen from reaching the lungs and can result in internal bleeding. This life-threatening side effect of being intubated requires immediate medical intervention. Options are normal and that the client should limit talking if it occurs. The nurse is assessing a client with an endotracheal tube and observes that the client can make verbal sounds. What is the most likely cause of this? Option A, this is a normal finding. Option B, there is a leak. Option C, there is an occlusion. Option D, the endotracheal tube is displaced. Right answer is option B, there is a leak. When conducting the minimal leak technique, the client should not be able to make verbal sounds or no air should be felt coming out of the client's mouth. While changing the tapes on a tracheostomy tube, the client coughs and the tube is dislodged. Which is the initial nursing action? Option A, call a respiratory therapist to reinsert the tracheotomy. Option B, cover the tracheostomy site with a sterile dressing. Option C, call the physician to reinsert the tracheotomy. Option D, grasp the retention sutures to spread the opening. Right answer is option D, grasp the retention sutures to spread the opening. If the tube is dislodged accidentally, the initial nursing action is to grasp the retention sutures and spread the opening. Options: calling respiratory therapist or the physician will delay treatment in this emergency situation. Covering the tracheostomy site will block the airway. The nurse caring for a client with a pneumothorax and who has had a chest tube inserted notes continuous gentle bubbling in the suction control chamber. What action is most appropriate of the nurse? Option A, increase the suction pressure so that the bubbling becomes vigorous. Option B, do nothing since this is an expected finding. Option C, immediately clamp the chest tube and notify the physician. Option D, check for an air leak because the bubbling should be intermittent. Right answer is option B, do nothing since this is an expected finding. Continuous gentle bubbling should be noted in the suction control chamber. Bubbling should be continuous in the suction control chamber and not intermittent. Options: increasing the suction pressure only increases the rate of evaporation of water in the drainage system. And this is not done without any prescription of the physician. Chest tubes should only be clamped to check for an air leak or when changing drainage devices. The nurse is assessing the functioning of a chest tube drainage system in a client with hemothorax. Which of the following findings should prompt the nurse to notify the physician? Option A. Fluctuation of water in the tube in the water seal chamber during inhalation and exhalation. Option B. Drainage system maintained below the client's chest. Option C. Drainage amount of 100 milliliters in the drainage collection chamber. Option D. Occlusive dressing in place over the chest tube insertion site. Right answer is Option C. Drainage amount of 100 milliliters in the drainage collection chamber. Drainage of more than 70 to 100 milliliters/hour is not normal and requires the immediate notification of the physician. A nurse is supervising a student nurse who is performing tracheostomy care for a client. Which of the following actions by the student should the nurse intervene? Option A. Removing the inner cannula and cleaning using universal precaution. Option B. Suctioning the tracheostomy tube before performing tracheostomy care. Option C. Changing the old tracheotomy ties and securing the tube in place. Option D. Replacing the inner cannula and cleaning the site of the stoma. Right answer is Option A. Removing the inner cannula and cleaning using universal precaution. When performing tracheostomy care, a sterile field is set up and sterile technique is required. Standard precautions such as washing hands must also be maintained but are not enough when performing tracheostomy care. The presence of tracheostomy tube provides direct access to the lungs for organisms, so sterile technique is used to prevent infection. The nurse is handling a client with a chest tube. Suddenly, the chest drainage system is accidentally disconnected. What is the most appropriate action for the nurse to take? Option A. Secure the chest tube using a tape. Option B. Clamp the chest tube immediately. Option C. Place the end of the chest tube in a container of normal sterile saline. Option D. Apply an occlusive dressing and notify the physician. Right answer is Option C. Place the end of the chest tube in a container of normal sterile saline. If a chest drainage system is disconnected, the nurse can place the end of the chest tube in a container of normal sterile saline to prevent air from entering the chest tube, thereby preventing negative respiratory pressure. Options: the nurse should tape the chest tube securely to prevent it from being disconnected, rather than taping it after it has been disconnected. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.